Welcome to this new episode focused on the clinical management of patients with chronic low back pain. So as we know, low back pain is one of the most common musculoskeletal disorders affecting the population worldwide. And in particular, chronic back pain is associated with a range of problems that tend to affect the patient in all aspects of their daily life. And therefore, when we approach a patient with persistent or also known as chronic low back pain, we need to understand the patient in a multidimensional perspective, and that includes not only the biological aspect of their pain, including biomechanics or any additional tissue injury, for example, that are likely to have already subsided, but also the psychological elements, the social domain, and also their interactions with their world, within their activities of daily living. Therefore, what we're proposing here is an approach centered on the patient, and it was what is also known as a psychologically informed type of practice. So in this first part, the emphasis here is on establishing the conditions that will enable the patient to feel safe, to discuss their problem with the practitioner, and to start the process of care. And to start the process of care starts with the development of a robust therapeutic alliance between practitioner and patient. So at the beginning, one of the important aspects of that is for us as practitioners to create the right conditions to enable the person that is likely to be worried about their problem, is likely to have seen a number of other practitioners, is likely to consulted with friends, as likely to search online, for example, has consulted widely with Dr. Google, for example. It's to create the conditions that actually enable the person to feel safe and to start talking about the problem.